as the world prepares to gather in Dubai next month for the 28th session of the Conference of Parties, that's COP28, health and policy experts in Africa are keen on having health as an agenda on the discussion table on climate change. As our very own Mashirima Kapombe reports, African experts want the continent to speak with one voice on climate-related diseases. Take a listen.
Climate change continues to be a key discussion with its effects on various sectors emerging.
If you don't have evidence,
Health now forming part of the discourse at the inaugural conference on accelerating agricultural adaptation in Africa in Abuja, Nigeria. Health experts from the continent now want the health agenda to take center stage in these discussions.
Tunahitaji kushughulikia mashida ya magonjwa ambayo inatokana na shida za mabadiliko ya tabia nchi, na hata tunapoelekea kuongea katika ile Conference of Parties 28 tuweze kuangazia jambo hili kwa undani ndiposa tuweze kupata suluhisho mwafaka.
If the climate change is affecting our agricultural system, say flooding, droughts, that means they are already having a reduction in quantity of food you can produce. That means also that we are having less quantity of food we can have access to, which can now have impact on the the nutritional aspects that we have, then which have impact on, say for example, the IQ of the children. The children are not properly nourished. There's malnutrition. There is stunted growth. The child is not growing as it should grow.
The debate was fueled by the increasing cost of health for governments in Africa, occasioned by changing weather patterns.
All research indicates that the health sector is negatively impacted by the effects of climate change, which means we are seeing a lot of more heat waves across the world. Africa is mostly more impacted. We are seeing more disease patterns that we didn't see before. We are seeing more mutations.
So if, for example, a whole community is having drought or having famine and everybody has to move, it has a way of affecting their psychology and their mental health. There are instances where farmers are committed suicide because they lot of their farm produce, whether animal or farm produce, they lose it because of that. They can't understand how else they are going to continue.
Diseases notwithstanding, delegates at the conference also called on Africans to grow plants and trees that are medicinal to diversify treatment, even as they conserve the environment. Experts now want the health agenda to take precedence in climate change discussions and for African governments to speak in one voice at COP28 in Dubai next month. Mashirima Kapombe, Citizen TV, Abuja, Nigeria.
All right, Mashirima, thanks so much for that.